Well, I always receive a lot of queries regarding Cushing's disease and syndrome, the differences and how to diagnose. Look, first of all, remember one thing. Any Cushing's which is due to increased ACTH from the pituitary, it would be known as a disease, remaining all are syndromes. So, Cushing's can be divided into two groups, ACTH dependent and ACTH independent. First of all, look, the ACTH dependent ones. ACTH dependent ones can be of two varieties, one from the pituitary. If the ACTH is secreted from the pituitary, it would be Cushing's disease. If the ACTH is secreted from an ectopic site, for example, small cell carcinoma of the lung, it would be known as a Cushing syndrome. In the ACTH dependent due to the pituitary, the patient will have hyperpigmentation due to increased MSH from the pituitary. While in the ectopic source, there will be no hyperpigmentation, rather the patient will be hyperpigmented. While those ACTH independent causes, it can be due to exogenous steroid intake, injectable or oral, and it can be due to a tumor of the adrenals. And in those both cases, ACTH from the pituitary will be decreased and MSH will be decreased and the patient will have hypopigmentation. Now, how to diagnose? First of all, you have a suspicion, then you can go for one of the three tests. One is 24-hour urinary free cortisol, late night live, or the third one, low dose dexamethasone suppression test, or even overnight dexamethasone suppression test. If it is normal, the Cushing's is unlikely. If it is abnormal, go for another test from the above three. If it again comes abnormal, then Cushing's is confirmed. Now you go for the diagnosis in between, ACTH dependent or ACTH independent. If the ACTH is more than 3.3 picomoles per liter, it is ACTH dependent. If it is less than 1.1, if it is less than 1.1 picomole per liter, it is ACTH independent. Okay, and then if the ACTH dependent causes, then you'll go for pituitary MRI. If there is an adenoma, most probably above 6 millimeters, it would be Cushing's disease. If there is no adenoma, then you can go for CT, MRI of the abdomen for ectopic sources, and even that somatostatin scintigraphy and ectopic ACTH can be found in that case. While if we go for the ACTH independent causes where the ACTH was less than 1.1, then you can go for CT abdomen and with adrenal imaging, and if there is a tumor or a lesion, it is due to that. Otherwise, the patient will be taking exogenous steroids. And remember one thing here, the treatment is also always of the cause, not a single treatment. It can be multi-dimensional approach. Thank you. I guess it explains it. And for a detailed video, you can visit my YouTube channel on which this topic is completely explained. Thank you so much.